I never thought this would be my next YouTube video. A couple of years ago I bought loads of equipment and fully intended on making videos on how to improve your life, whether it came to health, fitness, your mind, pretty much everything. I was at uni studying nutrition, health, fitness, and was dreaming of becoming a physio or a dietitian, and I feel like I'm still interested in those things, but a lot has changed, and today I felt like coming on and talking about how I was diagnosed with breast cancer and an autoimmune disease at the time that I felt most healthy. So here we go. So it was pretty much 3 years ago today. I was 32, turning 33, and I was running down the stairs without wearing a bra. So I was supporting my breast and my fingertips just landed on my left nipple, and I felt a hard lump there. It felt like a rock. I couldn't move it or anything. And at the time, I was on my period, and I know it's not uncommon for our bodies to have lumps and bumps. So I just logged it at the back of my mind that if it's still there in a week's time, I will go to the doctors and get it checked out. I've already been diagnosed with cervical cancer on my very first smear. I did make a YouTube video about it, but I've since deleted it and lost access to that channel. But it was stage 1A1, and I just had to have 3 loop excisions to remove it, nothing else. So it kind of didn't feel like cancer. However, my sister, when she was, I don't know if she was 23 or 24, she was diagnosed with a later stage cervical cancer. Apparently it's not hereditary or genetic, and she had to have everything. She's still alive today, and it's been like about 15 years. And my mum's mum has had breast cancer twice. She's no longer with us, but she didn't pass away from breast cancer. My dad's sister passed away from inflammatory breast cancer, a very aggressive type of breast cancer. And my mum's brother recently passed away from a rare type of cancer that started in his, I think it was in his face. So what I'm trying to say is, I've got a family history of cancer, and I knew it wasn't something I could just forget about, even though I really don't enjoy going to the doctors. So unfortunately it was still there. A week later I booked my doctor's appointment. When I got there, there was a junior female doctor and one of the senior male doctors. You know, when they just sit in the room beside each other and, yeah, see what the junior doctors do. And she had a feel, and we spoke about my family history and my concerns, and she referred me to the 2-week pathway. Apparently that's super normal and not really anything to panic about, just to make sure that it isn't anything that you should be panicking about. So 2 weeks went by, and I went to hospital, and a doctor, I don't know if it was an oncologist, consultant, who knows, but he felt it, and his words, I do not think it's anything to be concerned about. And I wonder to this day, if I had not spoke about my concerns and family history, if he would even have put me forwards for the ultrasound that I had right after speaking to him. But he did, so try not to think about that scenario. And I went for the ultrasound. There were 2 women in there, and they used some language that made me think, this doesn't sound right. A little bit worrying, but I was still hopeful, because, you know, there can be things in your breasts that need removing that aren't cancer. So anyways, they were saying that my breast tissue is dense. Apparently people with dense breast tissue have like a higher likelihood of breast cancer as well. It's something that I've learned through all my research. And they were saying it's quite hard to see exactly what's going on, but it looks suspicious, and there are sprinkles of something else. So they referred me again for a biopsy. And I was told by my doctor that if I needed a biopsy, it would all be done in one day, but it wasn't, and I ended up having to chase it up. But I did have the biopsy within 2 weeks of when I had that ultrasound. And the secretary was telling me that they only do everything in one day for people that are over 45, which I find a little bit strange because I've since learned from the oncologist that young people tend to get more aggressive cancer types. So you'd think it would be the other way around, but what do I know? So I had my biopsy. I intend to go into treatment and all the scans and stuff in separate videos because this video will just be so long and I have a lot to say about everything individually, like things that I think might help and just like my thoughts, feelings at the time, although it's all a bit of a blur if I'm honest. But within like less than a month, I like to think it was 2 weeks, I had a letter to go to hospital, and the Macmillan nurse came and got me from the waiting room, me and my partner, and I knew from seeing the Macmillan nurse that it wasn't good, but got in to the room and you could just feel it in the air, sat down, and pretty much just told me right away that I have cancer. And I didn't cry while they were explaining all this to me, but my partner did. He couldn't remember anything and I could remember everything, but I didn't know what the heck it all meant. It was like cancer language, I was new to it all. It was just totally foreign to me. So they confirmed it's cancer and the type of cancer and basically what my treatment plan was going to be, IVF, and also they talked about that I would lose my hair and gave me a wig voucher, and I just walked out in a complete daze. I felt so dizzy. I didn't cry in there, but when I was sitting in the waiting room, letting everyone know, like my dad and everyone, I started crying like mad. And the thing I was crying about was my hair. I was just like, I'm gonna lose my hair. And now I don't really care about stuff like that. If I lost my hair again, I wouldn't care, but for whatever reason at that time, that was all I could think about. So this is what they diagnosed me with. So the cancer type that I had was hormone positive. So that means that my cancer essentially feeds from my hormones. And also I had this thing called HER2, which they said makes it more aggressive and unpredictable. So even though they believe it's early stage, my dog's looking in the tree box. Even though they believe it's early, I've caught it early, they've got to treat it aggressively. And I needed to have an MRI just to make sure it hadn't spread anywhere else. So I think like 2 days later, I had my MRI. My dog's under the table. So I had my MRI and another appointment. They told me that my cancer didn't look like it had spread anywhere and it was around 16 millimeters in size. That meant that I could decide if I wanted to have surgery or chemotherapy first. But my surgeon told me that there's only a 60-40% chance that the chemo will work, which made me think, let's just whip it out then. And then he said the con to that though is that you can't see how the cancer responded to the chemotherapy, but I didn't want to go through chemo and then find that it had grown, especially since they said I had an aggressive type of breast cancer. So I had a lumpectomy and they took the first lymph node and that came back clear, but my margins came back unclear. So they said I would need another lumpectomy after chemotherapy, but the cancer had been removed. they told me that I didn't need a mastectomy. It would make like no difference, a lumpectomy or a mastectomy. So that is why I've had 2 lumpectomies, and my breast is about like half the size of the other one. Doesn't really bother me, but I will do a separate video on that. And yeah, I started chemotherapy like from the moment that I found the lump to starting chemotherapy. I don't even think 3 months had passed. Some people I spoke to, 6 months had passed, and they were like more progressed than me. It's actually wild when you start talking to people about these things. So I had the Red Devil and paclitaxel. I can't remember the original name for the Red Devil, but everyone in the cancer community knows the Red Devil, apparently. Oh, my light's just gone off. Let me fix that. Yeah, so from everyone I've spoke to, we all know what the Red Devil is. Those that know, know. And apparently breast cancer chemotherapy is like notoriously brutal. And I didn't realize at the time, because you'd think like all chemo is horrible, and I'm sure it is, but there's like types of chemo where people can still function, and then there's types of chemo where you can't, and it's all different basically. So there's no 2 stories that are the same, and then everyone's body reacts differently. And yeah, so I had chemo for about 5 months, and I did get a PICC line fitted. So if you want to know how I got on with that, I could add that to a separate video. But I'm really grateful that I got the PICC line fitted, because I've heard some horror stories about after like a couple of chemos not being able to find veins and stuff. And I'll definitely do a video talking about chemotherapy and things like that. But yeah, and then after chemo I had my surgery again, so the lumpectomy, the second one, and everything came back pretty good. So I just needed a little time for my body to heal before moving on to radiation, and I had 15 sessions, and then I was like feeling really good about myself and perkier than I had in a while. I also, during this time, was having 3 weekly injections called trastuzumab, and that was like an anti-cancer treatment to treat the HER2 part, and that is really stingy. Yeah, and you have to like rely on the nurse to take their time. I remember them telling me it should take about like 3 to 5 minutes, but some of them would do it in a minute, and I'd just be there like, come on now. So, and then there was like this little period where I just fell off a cliff and felt more ill than like chemo, radiation and everything. And I had just started endocrine, so the medical menopause. Nothing about it is similar to a normal menopause, by the way. That can be a separate video as well. And I kept going to my doctors saying like, I do not feel good, and they were saying these symptoms sound like very similar to menopause, so it's probably that, basically like fatigue, dizziness, shortness of breath. I really didn't feel good, and I was saying to them, but I feel worse than when I had chemo. And I had to keep going to my doctors. Eventually I got one that tested my thyroid, and it turned out I was I had a severely underactive thyroid, and they even said it was so bad you must have been like this for a while. So I think all through my cancer treatment I'd also severely had an underactive thyroid, and if you know anything about that, the symptoms are unforgiving. So that was nice for me, but it makes a lot of sense, because when I was talking to other people about their cancer symptoms and stuff, a lot of people were like concerned about about me. But then I spoke to some people, and every time they'd have chemo they'd be in hospital, and that didn't happen for me. So we're all different, and it's kind of like no point in comparing, even if you're on the exact same treatment, because we could have other underlying health conditions and our bodies just respond to things differently. But the endocrine treatment, which I've not really gone into detail yet, I'm on for 10 years. So it's weird when I tell people that I finished chemo and radiation, and they're like, oh, so you're all good now? But it's like, no. One, I'm not good at all. But two, I'm actually still on treatment. I was supposed to be on an anti-cancer drug, which is like similar to chemotherapy in a tablet form, until June just passed, but I couldn't tolerate it at all because of the chronic illness I've been experiencing pretty much since everything happened, called naratinib. I was on it for about 3 days, and I just decided I can't take this anymore, and it's preventative. So it's just a risk I had to take, and my oncologist agreed that I was having like some unusual side effects. Yeah, that was interesting. And so I'm having Zoladex, or I was, should I say, because last week I changed it to Prostap, which is like the same thing, but I don't know why they wouldn't let you decide which one you want, because Zoladex is really painful, implant in your stomach, and Prostap is like a liquid that they inject into your fat. I had it in my arm last week and I didn't feel it at all, but when I've been having Zoladex, they would use like a local anesthetic and then go in with it, and it still hurt and it would bruise. I've been having so much issues with the endocrine therapy, which is the medical menopause. I have to be in a medical menopause because that's what feeds my cancer. So when I tell people that I'm in menopause, they're always like, oh, have you tried HRT? Have you tried all these lovely things to help get through menopause? I'm not allowed because my body is not allowed its hormones. So, and then my thyroid, that's also hormone related, but different hormones. And my hormones have just been trying to kill me for whatever reason. So I was on Zoladex for 2 years, but I've been struggling. Last week changed it to Prostap, so I'm trying that for 3 months to see how I get on, and if the symptoms are the same, then I think I'll just stick to Prostap because it's less painful or invasive. But hopefully I'll have a little bit of relief. And then I'm on a daily aromatase inhibitor, which is just another thing that suppresses your hormones. I started on an anastrozole, the bone pain, next level. So then I tried letrozole, same problem. And then I tried tamoxifen, and that really messed me up mentally. So I decided to just stick to letrozole, and that's essentially where I am with my journey right now. I'm due my yearly mammogram actually this month, and a couple of weeks ago I had a nuclear bone scan because I'm really struggling with the bone pain, to be honest. And I asked if I was due a DEXA scan, which is really a DEXA scan. I think they just like to see like how thick, thin your bones are. And mine came back that I have osteopenia before I even started hormone treatment. And like the other day I had my bone infusion, which is zoledronic acid. You have to have it for 2 years is it 2 years or 3 years? Anyways, I've got 2 left. I had one 2 days ago. And it's just to kind of help with your bone health, and apparently it also helps prevent metastases to your bones. But right now, I have no evidence of disease, but obviously it's only been a couple of years, and they told me when they first diagnosed me that this cancer has the highest reoccurrence rate within the first 2 to 5 years. So I just feel like really tense, and yeah, I'm just looking at my little notes to see what else I need to tell you. Oh, I realised that I didn't go into detail about IVF. They did offer me IVF because obviously I'm in menopause, and also chemotherapy can put you in menopause. And I did actually go into menopause, like sometime through chemotherapy, but I declined IVF because they scared the life out of me, to be honest. And you know, they said I've got hormone positive cancer and an aggressive type. So to me, it just seemed like wild to pump my body with more hormones and possibly make things worse. And I'd actually thought in the past about adoption and things like that. So, you know, it is sad to have the choice taken away from you so suddenly, but I am very open to adoption, and I hope one day that that is something that I can do. But right now, I'm not like financially or physically and mentally stable enough for anything like that anyways. So yeah, I've not really gone into detail about anything today. I just wanted to get my first video out there, let you know where I'm up to now, and I just want to say thank you so much for watching my video and listening to my story. And if this is something that you can relate to in any way, I'm so sorry, but just know that you are not alone, and I really hope that this video makes somebody out there, even just one person, feel less lonely. And I really hope to see you in the next video.